Now, as the inflation and food prices continue to rise, a statistics agency shows that at least 10 million South Africans did not have the money to buy enough food in 2019. Food insecurity remains a leading health problem in the country. Now, to talk to us more about this, we're joined by Andy du Plessis from Food Forward South Africa. Andy, good evening and thank you so much for joining us.
Evening, Quina. Thank you for having us.
Let's go straight into that. I mean, your research says at least 10 million South Africans did not have enough food or money to buy food. I mean, was that a surprising statistics in your research, or was it almost expected looking at the conditions of South Africa?
Yeah, it was not surprising, and let's bear in mind that this was prior to the COVID-19 pandemic, and things have worsened significantly after that. In 2018 already, Food Forward South Africa agreed with the statistics from the Oxfam report, the hunger report, that said around 14 million people were food insecure, and that a further 14 million people were at risk of food insecurity. So this number is not surprising, and given the kind of cost of living crisis we are facing today, that number has gone significantly higher. According to our statistics, and it was reported last week in the survey by the Pietermaritzburg Justice and Dignity Group as well, that confirmed that over 30 million people across South Africa are now experiencing food insecurity for at least 1 or 2 weeks of every single month.
So talk to us then about and I think very important to address the gap, for the household's coping mechanisms in this regard, because it often leads to mental health situations.
Absolutely, and this is it's a growing phenomenon and increasingly of concern. So there are a few strategies that the poor have to cope. The first is when there is food and there's not enough food for everyone, the parents tend to eat less and they give the children more portions. And in severe cases, the parents skip meals and the children eat food. But what's happening more and more, especially across the Eastern Cape, which is really the worst affected region, is where we are finding that the parents and children, because there's just no income at all in the household, that they go without food for days on end. We've heard that recently that in the Eastern Cape, where over 100 new cases in the past 6 months of malnutrition have been reported, and over 43 children have died of malnutrition and starvation. And this is becoming increasingly a concern across South Africa.
Talk to us then about how anxiety and depression can be associated, and particularly with the studies that you've made, because we're talking about the poorest of the poor in this regard, but also you look at South Africans that naturally are trying their best, but it's just not enough looking at the living conditions in the country.
Absolutely, yes. South Africans are desperate because, with the cost of living crisis the way it is today, with inflation at 7% and food inflation year on year 13.6%, the South Africans are past the ability to cope. There are just no coping strategies. South Africans that have little or no money are already buying the cheapest foods and whatever they can get their hands on for the least amount of money. And oftentimes they are buying cheaper foods that are unhealthy, which will have health risks down the line, and an unhealthy workforce across South Africa. But from a mental state as well, people have given up hope. People are not looking for jobs. They are those discouraged group of workers that are not looking for work because there's just no doors opening up for them. And we are finding increasingly where children are being neglected and parents are giving up hope, and a lot of our children are dying. A lot of our pregnant mothers are underweight and giving birth to underweight kids, and 50% of our child deaths in hospitals is attributed to malnutrition. So the mental state of around half our population is quite chronic at the moment, and it has consequences for South Africa. So if we find vulnerable and desperate South Africans that go without food for protracted periods of times, when we're talking about days and weeks and sometimes several weeks at a time, people get desperate. and it leaves a very unstable political situation across our country, and it's something that we really need to be wary of and that we really need to address urgently.
You say also in your study that you found that 20%, that is 1 in 5 of the South African households were food insecure. And also in your research, you said you used the categories where you had food secure, at risk, and food insecure. Which ones were the highest at this point? And maybe if you could quickly clarify the differences between the tools that were used.
Yeah, so the roughly 50% of that cohort, 40 million, were food insecure. In other words, those are people that were suffering from food insecurity for at least 1 or 2 weeks of every single month. But the Oxfam report noted that a further 40 million were at risk of food insecurity. In other words, if there was some kind of shock like a pandemic or floods or riots, then that 40 million that were at risk would almost immediately become food insecure as well. And that's what we found around 2020 when we started out in March with the lockdown, level 5 lockdown, and there was just no income available because workers shut down. Even informal people that were relying on informal work was shut down, and there was no income in the households. That is where we really found huge amounts of people that have just overnight lost their livelihoods and had no way to survive. And what we found that 2 years later, 3 years later, now that we are coming out of the pandemic and starting this recovery process, jobs have not caught up to pre-pandemic levels, and that's why we find unemployment the way it is. And then this conflagration of huge unemployment, huge youth unemployment, and at the same time, a cost of living crisis that's deepening across South Africa, where there are no jobs, and huge malnutrition statistics are increasing across our country. And so we do find ourselves in somewhat of a perilous situation.
So what then, based on what you found, would be the solutions? I mean, as you say, the study suggested that food insecurity in South Africa remains a major health problem, and we've touched on the issues of anxiety and depression. So what would the solutions be in this regard, Andy?
Yeah, I think the first thing to say is that, government does not have the ability or the resources or the capacity to resolve this food insecurity crisis. And over the last 3 years, we've seen the non-profit sector, organizations like Food Forward SA, really come to the fore and assist vulnerable communities. So our view as Food Forward South Africa is this, that around 30 million people are food insecure today, suffering from severe to moderate food insecurity for 1 or 2 weeks of every single month. And purchasing food for those people it's inexpensive. I mean, it's too expensive and not sustainable. We have always maintained, and this is Food Forward SA's model, we've always maintained that the low-hanging fruit is to make sure that we harness and recover more of the edible surplus food from our food supply chain. So across farmers, wholesalers, retailers, manufacturers, throughout that food value chain, South Africa is wasting and losing over 10 million tons of food on an annual basis, costing our economy over 60 billion rand annually. And so what we want to make sure we do is, and this is why we've launched a food donations policy initiative, trying to work with government to make sure that we change legislation so that we can start to intercept timeously and recover this edible surplus food from the food supply chain. So, for example, a farmer that's growing for a manufacturer or a retailer, that farmer invariably has out-of-specification products. Either it's too big or too small, or they're blemishes, or it's come out ugly and not the way the retailer or manufacturer wanted it. What does the farmer do with that? We're suggesting farmers donate that food. On the manufacturing side, because they overproduce these goods, and they often are not taken up in the supply chain fast enough, before they expire, donate that food onwards to organizations like Food Forward South Africa. So, and by our calculations, if we were to recover just 5 million tons of that 10 million tons that's lost or wasted every year, we can provide 2 meals a day to around 30 million people. So the low-hanging fruit is to make sure that across South Africa, we get nutritious food to those vulnerable communities that are either eating unhealthy foods or they have no access because of an affordability issue to healthy and nutritious food. And this is why in South Africa we have over 27% of our children suffering from malnutrition, which is avoidable if we are able to recover the surplus food throughout the food supply chain, Gwena.
Andy, we're going to have to leave it there, but thank you so much for coming through to talk to us. That is Andy du Plessis from Food Forward South Africa. And I mean, the stats really quite worrying. 1 in 5, and also talking of the issues of anxiety and mental health, and especially having come out of the COVID-19 lockdown situation, things have gotten a little bit worse.